A 45-year-old patient is admitted with diagnosis of hypertension. The healthcare provider prescribed lisinopril and ACE inhibitor, right? What should the nurse assess for before administering this medication? A, serum potassium level. B, blood pressure. C, urine output. D, white blood cells count. E, allergy to penicillin. F, the ECG findings. And this is select or apply. When you guys are studying for pharmacology, it is important to know the mechanism of action of your medication. Do you guys know how many blood pressure medication there is? The classes? It's a lot. So the simple details of knowing what the mechanism of action of this medication are would help you almost get your questions correct all the time. So take for example, right, this medication's mechanism of action, right, it blocks the enzymes that convert angiotensin 1 to 2. And what happens when you block the enzymes that convert angiotensin 1 to 2? What happens? Moonlight. I love that. Your vessels start to dilate. Okay, and if this medication, right, if this medication blocks the enzymes that convert angiotensin 1 to 2, therefore blocking aldosterone, what happens in turn? Because when you block aldosterone, it reduces the retention of sodium and water and increases the excretion of sodium and water, but it may result to potassium retention, right? These are the little things that I want you to know. I want you to know that because I want you to be able to get, especially for a selected or apply, I want you to be able to get all your questions right? And so if the medication, right, is doing all this, especially blocking the aldosterone, and you know this will potentially cause a reduced retention of sodium and water, and possibly may result into potassium retention, no brainer, your urine output should come to you, because this is somehow could mess with your kidneys, right? And so when you're studying, especially when you know the mechanism of, and this is why I don't come on here without questions to you, tell you the answer and go by my way, okay? How your medication works is very, very important. ECG findings, this is hypertensive, ACE inhibitor. ACE inhibitor has nothing to do with the electrics in your heart. What it does, that's why I said you have to know the mechanism of action. Some medication does affect that part of your body, but not ACE inhibitor, okay? So you gotta know. And okay, so A says serum potassium level, obviously that's very correct. B, blood pressure, very correct. C, urine output, very correct. D is irrelevant to this question. E is irrelevant to the question. If A is right, then F is right. Okay, so this is the question. Patient is admitted with diagnosis of hypertension. The healthcare provider prescribed lisinopril, an ACE inhibitor. What should the nurse assess before administering this medication? Because a lot of you guys read too much into your question, had to take away from it. This is what you would assess before you give this medication, okay? And if you know, you know. Everything, again, with nursing school questions, is more than likely you have all your questions and all the answer options could be correct, but it's the reason why you have to critical think, remember the mechanism of action of your medication. I'm about to pull up your rationale. So this is your ACE inhibitor. We just had a question on this, right? And the suffix for this is pril. So whenever you get any medication that ends in pril, you have to know just these few words. It is not that bad. I know in your textbook, it might look like, oh, this is too much. All you want to know is that this medication, any medication that ends with pril, will block the enzyme that convert this to this. And when it does that, your aldosterone is blocked and then your vessels are dilated. And when that happens, your blood pressure, right, it reduces your blood pressure. And so aldosterone causes the retention of sodium and water. Using ACE inhibitor, aldosterone is blocked, therefore there is reduced retention of sodium and water, increased excretion of sodium and water, but may result into potassium retention. And these are your sides and adverse effects. And where you want to focus the most is your nursing implication, okay? So you want to assess for facial swelling, you want to monitor your blood pressure, you want to monitor patients for increased facial swelling and difficulty swallowing, which we already talked about your angioedema. And these are your patients teaching. Avoid salt, substitute, or food high in potassium. Why? Because of this, potassium retention. And again, we have it again right here, highlighted in yellow. Hyperkalemia. And you want to tell them change position slowly. Why? If they get out of bed too fast, they might get orthostatic hypotension and pass out. or fall, break a head or something. So you want to also teach them it's likely to experience persistent cough throughout the duration of this medication therapy. You also want to tell them report a persistent cough or angioedema to PCP, because you want to make sure, the guy to do that. Medication should be taken directly at the same time each day. And there's a black box warning for pregnancy category X. And what does that mean? Yeah, you don't give it to pregnant patient. A patient is prescribed amoxicillin for respiratory tract infection. What kind of medication is amoxicillin? It's an antibiotic, right? The nurse should educate the patient about what potential side effects. I tell you, most of your questions are gonna be patient teaching, side effects related, how your medication works on the body. So what would you teach your patient? Select all that apply. A, rash and itchy, right? B, tinnitus and hearing loss. C, diarrhea. D, photosensitivity. E, hypertension. F, hyperkalemia. Right answers are A, C, and D. A patient is admitted with suspected Tylenol overdose. Which action should you anticipate first? Everybody should know the antidote, and that's one of the things I'm going to give you guys for free on the app. All your antidotes. Okay, D, we all know that. That's the antidote for acetaminophen overdose. A patient is taking metropyl. I don't love this medication for myself, but I just like it. It's one of those medications that I learned the quickest in nursing school. It's a beta blocker for hypertension. The nurse should educate the patient about which potential side effects. Beta blocker. What is the goal for therapy for beta blocker? What is the mechanism of action for beta blocker? How does it work on the body? So you guys know OLOL is a selective beta blocker, right? And it works on what receptor? What receptor does? Because it's right there in front of you, right? I don't want to say everything. One. There's something before the one. I like that one. Beta, it's beta 1. It's beta 1 receptors. Okay? It is beta 1 receptor. Okay. And so this medication works to block, is a selective blocker for beta 1 receptor. What happens when it selectively blocks beta 1? I want you to understand the mechanism of action of a medication. That way it is easier for you to understand, and you don't have to memorize any day, any time. What happens? It decreases your blood pressure. Yes. Give me more. We already talked about that. Decrease your blood pressure. It's 4 things. I'm gonna pull out the book. Let's go. We're gonna flip the camera and decrease contractility. Yes. Cardiac contractility. Yes. What else? What else? Look at me smile. I like when you guys are giving me what I want. So this is your beta blocker, right? The goal, AV conduction. I love it. So the goal of this medication is to decrease the oxygen demand of the heart, right? So whenever you see any medication that ends with OLOL, which is selective beta blocker, what it does is blocks beta 1 receptors. And where that happens, it reduces your heart rate, decreases AV conduction, decreases cardiac contractility, and decreases renal activity, right? And the goal of therapy for this medication is to decrease oxygen demand of the heart. And so when that happens, right, what should you know from this tiny little box right here? As your nurse, you want to know these things, because this medication is going to work to decrease your heart rate. You know that once you check the heart rate or your apical pulse and it's less than 60, you want to hold it. You want to monitor. Why do you want to monitor blood sugar in diabetic patient? Because the signs and symptoms of hypoglycemia sometimes can emanate signs and symptoms of someone going through bradycardia. So whenever they're on this medication, you want to make sure you're also monitoring their blood sugar. Okay? So teach your patient not to stop medication abruptly. Check your hour before administering medication and change position slowly. We all know that. Okay. So the question is the side effect. Yes, it's A, B, and F. A, D, and F, sorry. So it's your orthostatic hypotension. That was right there. Weight gain and bradycardia. So let me pull up your rationale. A patient is prescribed Coumadin for anticoagulant therapy. What is the nursing priority action before administering the first dose? Okay, I like this question. So a patient is prescribed warfarin. You guys know this is an anticoagulant, right? What is the nurse's priority action before you give this medication? A, verify the patient vitamin K intake. B, assess for any history of GI bleed. C, check the patient INR. D, educate the patient about the risks of infection. E, confirm the patient's current weight. So what are we doing? We're all assessing, right? We want to make sure we check for the patient's INR. What are you trying to establish by knowing the patient INR? How fast the blood clot? And I see someone say A, verify the patient vitamin K intake. You want to assess the patient's INR first because you want to make sure you have a baseline for a starting point for the anticoagulant therapy. I'm going to just put up the rationale for a few seconds, and then I'm going to move to question 6. Ooh, I love this. A patient is prescribed Thyroid, levetiraxine for hypothyroidism. What should the nurse monitor to assess for the effectiveness of this medication? I love it. With your farm questions, they can go either way. You never can tell what the medication, what your question is gonna be pulled from. Okay, so what are the signs and symptoms of hypothyroidism? And what are the signs and symptoms of hyperthyroidism? Someone said hyper, everything is elevated. I love, that's the best way to think about it. And for hypo, everything is kind of like trending downward. And so if you're giving this medication, that's probably going to increase your thyroid level, right? It's probably going to affect your R rate. And that's why the person that went with BND, I mean, she's correct, but I just wanted to know for sure if she has a good understanding as to why. And so that could help for the future. Okay? But yeah, BND, correct. All right, let me pull up your rationale. A patient is receiving IV heparin. The nurse should monitor for which potential side effects. Select or apply. Yeah. So increased blood pressure, elevated APTT, hematuria, bradycardia, petechia, and ecmosis, increased urine output. B, C, E. Okay, that was easy. A patient is prescribed simvastatin for hyperlipidemia. What should the nurse instruct the patient about? What should the nurse instruct the patient about taking this medication? A, take the medication with full glass of grape juice. B, consume a low-fat diet. C, avoid alcohol intake. D, report any unexplained muscle pain or weakness. E, take the medication in the morning. F, increase daily intake of calcium. Why are we not taking grape juice? Does anybody know? So I said it. Okay, we want to tell them to consume a low-fat diet, avoid alcohol intake, report any unexplainable muscle pain or weakness. Yes. Take the medication in the morning. It doesn't matter. Increase diet intake of calcium. It's not related to the question. So you guys are correct. It is B, C, and D. Your patient is prescribed Xanax for anxiety. What assessment is the nurse's priority before this administration? Blood pressure, serum potassium level, respiratory, liver function. So you guys are going C. Are you guys familiar with this medication? I think it's a pretty common medication that a lot of people take or know someone that takes. Yes, your answer is C, correct. Your patient is receiving IV Van. The nurse should monitor closely for what potential side effect. A, octotoxicity. B, hypokalemia. C, hypertension. D, bradycardia. E, hyperglycemia. F, thrombocytopenia. We all know A is correct. What else would you monitor for? What could happen to the body if you know that this, because again, your questions would not always be clear it won't tell you the right answer right in front of you. So you know this patient could potentially have some nephrotoxicity going on, and if that happened, cardiac wise, what would happen to that patient? Nephro, your kidneys could be messed up. Cardiac wise, high blood pressure. See, that's the one they tell you with nursing school question. I promise you, if they tell you one answer option is correct, it is correct. So yes, high blood pressure, but when I explained to you, now you understood why that could happen. But it's not gonna be glaring to you in the first place. And so that's why you have to think. I'm thinking I could see nephrotoxicity on here. It's not on here. So yeah, that was critical thinking right there. That's critical thinking. So your right answer is A, C, and F. A nurse is caring for a patient with chronic heart failure who has been started on DIG. So this person has chronic heart failure. They've been started on DIG. Which of the following finding would be most concerning and warrant immediate intervention? Okay, so you have a patient, they have chronic heart failure, they've been started on DIG. Which of these findings will warrant the most immediate intervention? A, potassium level of 4.0. B, blood pressure 128/78. C, an epical pulse rate of 54. D, patient complains of fatigue after mild activity. E, mild peripheral edema noted at ankles. F, intake of banana for breakfast. C, right? We all know C. That's very concerning. Okay, so everything else are things that are kind of expected of a patient that has chronic heart failure, such as edema and fatigue. Edema is expected. Also, fatigue after mild activity is expected in patient with heart failure. And again, this question is not a select or apply. One option is correct. Okay, so if it was selected or apply, would say that it's just one choice, and so you have to go with what you think is the most correct. I see people say C, D, and E. What is most concerning to you? And if this was to be a selected or apply, honestly, mild edema noted on the ankles would not be the most concerning form, even if it was a selected or apply, because again, this patient has chronic heart failure. Okay, but we're not gonna talk about that. Okay, also patient complains of fatigue after mild activity. Also, they have chronic heart failure. They'll be fatigued. They have all this fluid flowing around in their body. That's expected of them. So C is a strong correct answer. Nothing can contest. A patient with COPD has been prescribed theophylline. Which of the following should allow the patient for potential theophylline toxicity? Yes, C, and C. A nurse is caring for a patient with type 2 diabetes who is started on metformin. Which statement by the patient indicates a need for further teaching? A, I will monitor my blood sugar regularly. B, I should not drink alcohol while taking this medication. C, it's okay to take this medication with a fatty food. D, I will report any unusual muscle pain. E, I might have some stomach upset when I start this medication. F, I can skip the dose if my blood sugar is controlled. Someone say F if you want to. Don't do that. You cannot skip your dose. Patient with migraine is prescribed sumatriptan. Which of the following is a contraindication for its use? History of peptic ulcer disease, age of 55 years old, history of CAD, use of acetaminophen for occasional pain, blood pressure of 115/70, F, report of photophobia during migraine episode. Okay, I love that. So I get it. I get that you guys are saying C. I get it, but I want to ask a question. What could happen to a patient who takes sumatriptan and has an history of CAD? It can cause coronary artery vasospasm. Let's see. A patient in the area reports sudden onset of shortness of breath and tightness in the chest after eating shrimp. The nurse should anticipate administer which medication first? Rescue medication, right? Someone said E, prednisone. Someone said A, albuterol. Oh my God. And here's the thing. With nurse's school question, honestly, all the answer option might be correct. But which medication would you give first and would more than likely save this patient's life? Okay, 10 out of 10. I would recommend epi. This patient is going through some vasoconstriction right here. Okay, they have shortness of breath, tightness in the chest. Albuterol would do little to nothing to them. Okay, now what could you give after giving epi? Albuterol. Then you go with albuterol, right? A patient asks the nurse about using a nasal decongestant for stuffy nose. Which of the following statement by the nurse is most accurate? You can use it definitely as long as it helps. They are best used for chronic congestion. Long-term use can lead to increased congestion, and that is called what? It's called rebound. Long-term use of the decongestant could cause increase. That's your answer right there. But D, it would help relieve your sneezing and itching. E, they also have anti-inflammatory effect. F, you should pair it with an antihistamine for best results. So yes, C is your right answer because it could definitely cause a rebound. Which alternative antiemetics should the nurse anticipate the physician would order? And you guys know what? I didn't want to give you guys the I was gonna go with just the generic name, but I was like, let me make your life easier and and give you guys the trade name. That's how you guys I should have done that. I should have done that. Zofran is ondansetron. They've taken that. all right, it's not helping. So what do you think they could take next? B is Reglan. A patient is prescribed Cipro for UT. Which of the following instructions should be included in patient's teaching? Limit fluid intake to avoid frequent urination. B, take the medication with milk to avoid stomach upset. C, report any tendon pain or swelling immediately. D, decreased appetite is a common side effect. E, the medication can be taken with antacid for heartburn. F, a skin rash is common side effect and is not consigning. You guys know Cipro has a black box warning for what? What is the black box warning for Cipro? Tendon rupture. I love this question. So your patient has a penicillin allergy and they require an antibiotic. Which class of antibiotic should you use with caution? A, tetracycline. B, macrolide. C, fluoroquinolones. D, aminoglycoside. C, cephalosporin. F, sulfonamides. What are you guys telling me? Okay. If your patient is allergic to penicillin, you cannot give them cephalosporins. And this is gonna be our last question for today, y'all. Question 20. Your patient with IBS is prescribed Bentyl, dexcyclomide. The nurse should instruct the patient to report which of these following side effects. For Bentyl, you guys will know this. A, dizziness. B, dry mouth. C, constipation. D, abdominal discomfort. E, diarrhea. F, excessive salivation. Okay, someone say A or D. What is the rationale behind that? Someone say E, diarrhea. No. Bentyl causes dry mouth and constipation. It doesn't cause diarrhea. And this is why you have to know the mechanism of action of the medication. It causes dry mouth. It causes constipation. What would A signify? In a patient taking Bentyl and they are reporting dizziness, what does that signify? What does that tell you? It's a sign of what? Toxicity. That's it. I love you. And if you need help with anything in nursing school, your help is right here. Okay? Go grab your study guide. Love you all. Bye for now.